Hi boys and girls, I'm Dr. Nikita Vizniak with the amazing
Dr. Andrew Vargo.
And today we are going to do a minor surgery review. I had to do this as part of my certification back in Portland, Oregon, all of, I don't want to admit it, about 20 years ago. And Dr. Vargo, when did you do this?
About 20 years ago. Yeah. I sutured a few humans up and now I teach it. That's how MD medicine goes. See when do and teach one.
Okay, fantastic. All right, so today we're going to look on a basic simple suture and we'll progress through that. We have some sample pig anatomy that we can use for this and we'll pass it off to Dr. Vargo here.
Thank you, Dr. Vizniak. So before I start suturing up a wound, so we're going to pretend this pig has endured a laceration. We're not pretending it has. So this is the wound that we're looking at right here. This wound that you can see from the top, and Dr. Vizniak has also given a wound to his fork hock as well. So what we're going to do is first we're going to make sure we have the right tools to suture this shut. What we have is a set of needle drivers. These are like hemostats, except the jaws are much shorter. They're very strong. They click and lock, click and lock. And since the jaws are so short, it gives you a lot of leverage to hang on to the needle that's attached to your suture material, your thread. So, needle drivers. The next thing you'll be needing in order to handle tissue that you don't want to kill, okay? So if I took these needle drivers, grab this tissue, slam down on it, crunch, that's the end of that tissue.
You damage all the capillary beds in that area. All that crush injury means it's very hard for the body to heal from that. So we want to avoid that at all possibility.
It would be bad news. So instead you take these are called an Addison's forceps or a rat tooth forceps. And if you zoom into it, you can see that there is interlocking pointy little jaws or teeth at the end of this forceps. And that allows you to grab tissue tightly, because this is slippery, puncture it, but not crush it. Puncturing is no problem. We're going to puncture this part of the process of trying to put it back together. Crushing bad, okay? So we'll also use this to handle some of the threading sometimes around the suture material. These are, you guessed it, scissors. They're used mostly for cutting suture material. If this was a laceration where we were going to sew together or suture together the deep fascia, we'd use it to kind of isolate it either in a reverse dissection technique or a forward dissection technique, but we're not going to do that today. This is mostly just for cutting suture material. So the last thing that we need, of course, is going to be your needle and thread, your suture. So the outside of this package is not sterile. The inside of it is. So what we're going to do is I'm going to open this package up. I'm going to pretend this whole field is sterile. Okay? What I'm going to do is I'm going to open this package up. I'm going to open the dirty package up away from the sterile field. And now the inside of this package is now sterile. And as it opens, it naturally flips onto your sterile field. And I've kept everything kind of clean. As well as I work, I'll try not to put my face over top and breathe on the wound. That's a big no-no.
Yeah, you wouldn't even realize it, but just simple gravity falling from you all the time is going to be all kinds of bacteria and other potential microbes that could get in there and cause an infection in that region.
And you're going to be tempted to, you're going to look, am I close enough? You're definitely too close. You're bacteria close. Yeah, anyway. So what I'm going to do, you've got another package. So beware, there is a sharp instrument in here. Okay, so I'm going to open it up. And they protected you from the sharp instrument by putting it in cardboard. Get rid of that. Here we go. Here we got some cardboard. Okay, so what are we going to do with it? It says fold corner back, so you can take this corner here and fold it back. It's got a little tab there. I always find it hard to do with gloves though, so I don't mind folding this corner just like this. If you open it like a book, you're going to be safe, because as you open it, there you go. There's the needle, and your fingers are away from it. Now, you are allowed to touch the back end of the needle near where it joins the suture material. It's impossible to handle if you don't, but never touch the tip. That is finely honed surgical steel. It will go through your glove, it'll go through your skin. It's unpleasant. So I'm going to pull it out. You got this springy looking situation. That's going to be really hard. It's like tying knots with a slinky, and that's hard.
Let's even put it down here so we can see it.
Let's put it down here, yeah, where you can actually see it. Yeah, it's all springy. So what you're going to do is you're going to stretch this material out. So I'm going to take my other hand, because I like using my right hand to stretch it out. Again, never touching the tip. And where you have to grab this is you have to grab it at the junction of the metal and the string. Don't grab the metal. If you grab the metal, you're strong enough, you'll pull the suture material right off the needle. And I'm going to pull it straight.
And if you do that, you're grabbing a new suture. All right, so straightening it out, fantastic.
That's better. It's easier to work with. It's not perfect, but it's good enough. Yeah. So
it's frustrating when you're trying to work and you've got this big slinky wrapped around that you're fighting with the entire time. It makes it really difficult.
You might say an expletive or two. So the next thing, so I'm going to put this needle, and I'm going to know exactly where I'm going to put it. These are hard to see. actually. So maybe what I'll do is I'll just load this up with my needle driver just for optimal safety. Note, again, not touching the tip, okay? Not touching the pointy part. I'm going to grab, and this is called loading your needle driver.
Let's put it even down here so we can see.
Yeah, it's actually, look here, actually put it over top of the contrast, the pig skin. So you'll note that I'm not right at the back end of the metal, okay? If I'm at the back end of the metal, even as I turn this needle, it'll start to want to bend where I'm grabbing it. So I want to even adjust it a bit more and move. So it's almost like you've got 60% of the metal on the cutting side of the suture and 40% on the back side. I'm going to lock it, I'm going to put it right here, and then I know where it is, and I feel safe. The next thing I want to do, I don't want to work with this patient in this direction because I'm going to be working against myself. It's very annoying. What I want to do is I'm going to change my patient orientation. Oh, that's nice right there. When the laceration that you're dealing with is perpendicular to the plane of your belly and your hips, okay? That's naturally, you're squared up.
Maybe athletic stance. You want to get in there, be ready to move, okay?
That's right, that's right. In case the anesthetic didn't work, and the patient gets upset and assaults you, be ready. Don't do that. Anyway, so what I have here is I have my Tooth Forceps for handling the skin, and the first throw that I put in, and I'll only do one throw for this video. The first throw that I'll put in, it will be across the center. Why across the center? Why not at the end? If you do it across the center, you can make sure that the wound is lined up. So for example, I've got a wound here. If, for example, I started suturing up here, and I made little errors as I went down, and the edges of the skin started to be not lined up, see that crinkling? That crinkling equals scar.
Yeah, so again, it's absolutely fundamental for this that you have perfect alignment as much as possible from all the fibers across.
It ends up with a really nice result. So there's going to be two techniques here, and you'll see me do one technique and Dr. Vizniak do another, and they're both right. What you'll do is you'll grab onto the skin, you'll evert it just a little bit, so that when your needle hits that tissue, it's hitting the tissue, and the needle's kind of at a 90-degree angle. And then I'm going to start about 2 to 3 millimeters away from the edge. What I'm going to do is I'm going to use the natural movement of my wrist to do a circular motion through that skin. Now what I like to do is I like to stop and reload. Dr. Vizniak's not going to reload. It's actually faster for him not to reload.
Yeah, if you're trying to cycle through these quickly, I like to go ahead and spin. A little bit of difficulty there, but spin and get yourself right around. So I'll typically hold down with the end of the other side, lift up here, find my opposite edge, and then come on through.
And what he did there was quick. And you know what? It is absolutely mandatory to go through like that, because once you close that laceration, you're not going to have the opportunity to grab it here and open it up. You'll have sutured it shut. But I have the luxury of doing that right now. So what I'm going to do, I'm going to come out, try to come out right, make it so that we've almost got like a cross, where the angle of the suture is going to be exactly perpendicular to the angle of the laceration. So this is tricky, and those of you that do a little bit of knitting, crocheting, sewing, or whatever are going to find you're just inherently better at this. Maybe even better than I am at this. So I'm going to reach underneath here, evert a little bit, come up hopefully with about the same, what they call a bite, the same distance from the edge of the laceration. Grabbing a little bit close to the needle there. Okay, what have we got? This is so-so. There's a little bit of an angle there, but it's not bad. If you didn't perpetrate that angle all the way along, that probably wouldn't scar. Mild angle there. I'm going to leave it in, okay? So next thing that we're going to do is the thing that makes you look really cool, tying a suture effectively.
Just before we do that though, I want to point out one thing. If you look at Dr. Vargo's incisions right here, where he's actually gone through with the needle, you can see how his punctures are really close and equidistant from the actual scar. That's what happens when you take your time a little bit more through this. If you rush through a little bit more quickly, you can see how this one is close to the edge and this one's a little bit further away. So again, that can change the pull of the fascia on either side and potentially offer differences in scar tissue formation. Depends what your goal is. If I'm on the battlefield and you want to sew somebody up as quickly as you can, then you're looking at this kind of thing. If you want to do a more cosmetic job, you're definitely looking at that kind of work.
Ah, the battlefield.
Yes.
Yeah. Anyway, so what we're going to do, so in order to tie this knot, okay, we've got a few things we have to do. A, we have to make sure that we're not stabbing any of our neighbors or the patient or anything like that with a needle that's flailing around. Okay, so be cognizant of where your needle is. I like to put it down a little bit towards myself. And not only that, I don't do big movements. Okay, this is one of the advantages of dealing with lots of suture material. Once this needle comes down, it'll kind of stay there. The next thing I'm going to do, I'm going to make sure I pull my suture across so that I'm not wasting too much at the end. I want about 1.5 centimeters at the end. So in the end, eventually this is just going to get cut off. And if you've got a foot of suture material sticking out, that's all wasted. It's gone. And you'll have to do like 50 sutures to do 2 stitches. Anyway, so what I'm going to do is I'm going to put my needle driver in the center of the wound right over top of it. And so when you tie, you start out with your knotty instrument. The needle driver is also a knotty instrument, parallel to your wound. I'm going to do loop it around once. I'm going to loop it around twice. Okay, give myself a little bit more space. You could even loop it around 3 times, but you don't usually have to. And note that the suture material goes right next to the hinge of the box of my needle driver. I'm going to grab the end, that little bit of end that's left, lock it shut, and then I'm going to go from perpendicular over the wound, parallel over the wound to perpendicular. I'm going to pull the knot against itself. And there we've got a nice knot. Okay? So the next thing, all you do is you repeat that motion. Okay? Needle driver in the center, knot around.
So you have 2 options here too. Like some people like to keep it spaced and then keep working around. I prefer to do a double where I'm using both hands at the same time. So I'll just wrap, even a triple wrap if you want, and you can cycle through this relatively quickly once you get into it.
Now, you can still, after the second knot, you can still, oops, I pulled a little bit of suture up there. You can still tighten a little bit, okay? But after the second one, that's it. You can't tighten up anymore. That's what you've got. So if it's too loose, then you have to do it again. And so do another couple of throws, loop around, grab the end, pull it through, change direction. And I'll usually do 4. Okay, that's a little bit long there. Come back here. There we go.
I like 2 or 3 myself.
Grab the end.
The other thing I'll point out is you see me jumping up and down right here all the time. I herniated a disc about a month ago, so just me moving around back and forth helps my back feel a little bit better when I'm changing position a lot.
It's being educational and therapeutic.
And therapeutic, and it's my homage to Dr. Vargo here for doing such fantastic work.
Oh, thank you, thank you. Okay. Your last tool, your scissors. What are you going to do? Cut thread with them. How much thread do you want to leave? Oh, I don't know, about 3 millimeters. Any more than that's too much. There. There. So then you've got a knot that looks okay. How do I know if this knot's okay? Dr. Vizniak's going to test my knot.
So when I was in school and we were teaching this, typically what do? We wind up going on and we pull on the edges of the knot. You pull on the threads, see if you can take it apart. And this is a fantastic knot, and in fact, we should get rid of these. I dock him a few marks for leaving his fibers out here. Okay, all right, but otherwise it's fantastic. Really good knot. That 4 loop over really actually gets it really locked in place. I'll usually do 2 or 3 loop overs, and you can kind of come in again and see and pull on the tissue and see that usually they hold fairly well. So depends.
3 is good enough. Yeah.
Okay. All right, so hopefully you found this useful, and we thank you very much for your time. Is there anything else you want to add?
I think we did it.
Okay.
I think the patient will be okay.
I think the patient is going to make it to the dinner table this evening. That will be fantastic. One other thing that I will point out is, of course, what do we do with this, Dr. Vargo?
You stick it into your partner.
Okay. Are you ready? Yeah. So, of course, you're going to put this into a sharps container when you're finished. All right? And you can cycle through. How many do you think you can do off of one loop like this?
You could probably do 7 or 8 stitches.
7 or 8 stitches off of one loop like that. Again, it's not that they're expensive, but we just don't want to be wasteful, so try and use as much as you can of your suture material. Get out there and have fun. Thank you very much for your time, and hopefully you found this useful.